We interviewed or asked some of your students, both past and present, if they had any nice things to say or any favorite memories of their time with you. So I wanted to pass it over to Kat, one of your previous students, to go first.
It's hard to choose a favorite memory of one of my classes with you and just my time in the undergraduate CSD program because I literally have too many to count. It is not an exaggeration to say that you are truly one of the kindest and most genuinely caring professors and people that someone could ever meet. You take the time to get to know each and every one of your students personally, asking us about our day, the important things in our life, remembering the things that we care about, and helping us to navigate any challenges or uncertainties that we had. If I had to pick some of my favorite memories with you, I would have to say our time as part of the UF Ukulele Club. And when we put our spring concert on, I thought that was so much fun. In short, Dr. DiFino is an angel in human form, and I'm so grateful that I was able to take classes with you during my time at UF.
That's so precious, and I have those wonderful memories. Thank you. Hello, my name is Dr. Sharon DiFino, and I'm a clinical assistant professor in the Department of Speech, Language, and Hearing Sciences in the College of Public Health and Health Professions.
First question, sneakers or sandals?
Sneakers.
St. Augustine or Boston?
Ooh. Boston.
What's one thing that you can't live without?
Decaf espresso.
What is your favorite song to play on ukulele?
You Are My Sunshine.
And what's one talent that you wish you had?
The ability to sing. I can play string instruments, but I cannot sing.
On to more serious questions. So first, you founded the Bilingual Language Access and Outcomes Lab at UF. Can you talk a little bit about your research there?
When I started the lab, Charles Ellis, our chair, approached me and said, you know, we really need more representation for the bilingual speakers in our state. And so my bilingual lab looks at where language and culture can be a barrier to individuals whose first language is not English. Either their language or their culture blocks them or is a barrier to equitable health care or just even accessing health for any number of reasons, not just language. It could be not understanding how to navigate the system. So I started the lab with a few members. It was very small, and then it grew. And we don't just look at Spanish-speaking individuals, but we have students in the lab who come from different countries. So we looked at all of those different communities, and students focused on conditions they either had to live in, work in, or conditions that prevented them from positive outcomes for equitable health care.
What's been the most rewarding experience that you've had while teaching?
To be honest with you, it's not just shaping young minds, and I have to tell you, I love undergrads because they come so, fresh. They're freshly minted out of high school, and so they're very open to learning new things, and they're like sponges. And so I love watching them grow. But the reality is, I love the development of the rapport with my students, and especially as they continue on, and many of them have stayed in contact with me, and watching them mature into men and women. And I've been to weddings, baptisms. They've become sort of like an extended family to me. And that's the most rewarding, is having that mentor-student rapport and watching them grow.
If you could give one piece of advice to your students, what would that be?
My favorite quote from Winnie the Pooh, and that is, "You're braver than you believe, stronger than you seem, and smarter than you think, and loved more than you will ever know." So be strong, be brave, you're already smart, and go out of your comfort zone, because the world offers many opportunities, and so go for it, and don't let anything hold you back.